Okay, let's keep going. So these slides show you your pituitary gland, including the anterior pituitary gland, release 7 different kind of traffic hormone. I call it traffic hormone because this is the hormone trigger another hormone release. And also you have the posterior pituitary gland release 2 hormones, ADH for water reabsorption and oxytocin. Oxytocin triggered the milk leg down reflex. Okay, now let's look at thyroid hormone. Thyroid hormones has a lot of blood supply, and its function is release the 2 hormones T3 and T4. Both have super long names, so you can tell them T3 and T4. Their function is metabolism. And when the patient have hyperthyroidism, and that's when these 2 hormones release like crazy, and it turns out their metabolizing rate is pretty high. And if they have hypothyroidism, they feel cold all the time because their metabolizing rate is low. And this shows you your thyroid gland. That's your thyroid gland. In the posterior part of your thyroid gland, you have 4 small glands, and they're called parathyroid gland. Parathyroid gland release parathyroid hormone, and their function is calcium. They maintain the calcium concentration and in your blood. And the parathyroid hormones, their main target is osteoclast. We talk about these cells in a bone. That's the cells eat bone matrix. And in the bone matrix, the main component is calcium. So the parathyroid hormone will ask osteoclast to increase the bone absorption part. So they're going to release the calcium into the blood. They can maintain the blood calcium concentration. And that's the posterior part of your thyroid gland. These 4, they are the parathyroid gland. Next one, adrenal gland. Adrenal gland can be divided into the outside part and inside part. The outside part is called adrenal cortex, and the inside part is called adrenal medulla. They release different kind of hormones. So that's your adrenal gland. They're located above your kidney. That's your adrenal gland. When you cut the adrenal gland open, outside is called adrenal cortex, release steroid hormone. Inside the adrenal medulla is part of the nervous system, release epinephrine, norepinephrine. That's your sympathetic nervous system. And this slide shows you those 3 hormones released by the adrenal cortex. And the first one is cortisol. So cortisol is your stress hormone. Its function is glucose metabolism. When something stressful happens, you're gonna release stress hormone, and this one will ask your body release more glucose. So your blood sugar level will increase and help your muscle to be able to use those glucose produce ATP to deal with stressful situation. The second one is aldosterone. We'll talk about this hormone in the renal system in the kidney. Its function is sodium reabsorption. It will trigger the angiotensin II release, and its function is sodium reabsorption. So when you take sodium back, it will take water back. So its function is regulate sodium and water. The third one is androgen. That's the male sex hormone. And this slide shows you your adrenal cortex can divide into 3 layers. You have 3 different hormone release. Adrenal medulla, that's the inside part, release 2 hormones. Sometimes you found they call the neural hormone because a lot of books consider the adrenal medulla is part of the nervous system. It's part of the sympathetic nervous system. Release mainly epinephrine, and it's like 80% epinephrine, 20% norepinephrine. And their function is like the sympathetic nervous system. They will increase your heart rate, increase the contractility, and make you be able to hang in there, open your airway. And because of the powerful function of epinephrine, in the EMS, they actually have a bottle of epinephrine to treat patients when they are in critical situation. They can increase their heart rate and contracting force. I'll leave this to you. Okay, next one, pineal gland. Pineal gland is a structure in the brain. It releases melatonin, and melatonin controls your sleep-awake cycle. Now let's go to the pancreas. Pancreas is an endocrine and exocrine organ. Here we focus on the endocrine part and release the hormones. When we go to the digestive system, we will talk about the pancreas again. It releases the exocrine digestive enzymes to the small intestines. And the two hormones released from the pancreas, the insulin and glucagon, both of them regulate your blood sugar level. So insulin released by the beta cell, glucagon released by the alpha cell. And diabetes 1 patients, diabetes 1 is an autoimmune disease, and their immune system attack beta cell. So when the immune system kill all the beta cells, they won't be able to produce insulin. So that's why the diabetes 1 patient have to self-inject insulin because after every meal, because their body don't have insulin. And that's the pancreas. So next to the duodenum, that's the beginning part of the small intestines. It can release digestive enzymes to the small intestines. And this slide shows you the microscopic structure of the pancreas cells. So in the pancreas, you find those structure we call the isolate of leg and hand. And that's the endocrine part. They release the insulin and glucagon. And the outside, these cells are for exocrine. And let's look at the function of insulin and glucagon. So insulin's function is to lower your blood sugar. After you eat a big meal, your body releases insulin. Insulin will target the muscle, mainly the muscle and also fat cells, ask them to take glucose in so your blood sugar level become lower. Glucagon's function is to increase your blood sugar. If you don't eat meal, did not eat anything for a few hours, you feel hungry, then glucagon release. Glucagon release, its function is to ask your liver have the glycogen, that's the polysaccharides, that's the sugar chain, and they will cut this into simple sugar, that's the glucose. So they're gonna release the glucose to the blood, and your blood sugar level start to increase. So the glucagon will increase your blood sugar. And because of these two hormones, insulin and glucagon, and turn out your blood sugar level is well maintained. If your blood sugar level is high, pancreas is gonna release insulin. It will do everything within its power to decrease your blood sugar. If your blood sugar level drop to be too low, it's gonna release glucagon, and glucagon will increase the blood sugar level. So your blood sugar level is maintained in this normal range, homeostasis. So this shows you your blood sugar level is high, and insulin release, it will do everything within its power to lower your blood sugar. If your blood sugar level is low, you're going to release glucagon, and glucagon will increase your blood sugar level. So eventually your blood sugar level is maintained, part of the homeostasis. And when the blood sugar regulations goes wrong, that's diabetes. So you can have diabetes 1, you don't have insulin. Or you can have diabetes 2. Diabetes 2 is we call the nature and nurture. So diabetes 1 is nature, and diabetes 2 is nurture, is environment caused. It's your body become in response to insulin. And diabetes, you found exercise help, because exercise apparently will ask your muscle to take glucose in. So it turned out it can lower the blood sugar level. So exercise can help diabetes too. And now let's look at the stress hormones when it goes wrong. So when you have stress, it can threaten your stress hormone homeostasis. And the stress can be divided into 3 phases: the alarm, the resistant, and exhausting. So the first is alarm phase. Alarm phase is something dangerous happen, and your body are in the fight or flight mode. So we talk about the autonomic nervous system. The sympathetic nervous system is a quick response. So in the alarm phase, it's mainly the sympathetic nervous system. And it will also go to your adrenal medulla, because adrenal medulla is part of your sympathetic nervous system, release epinephrine, norepinephrine. So it will get your body ready to fight, increase the glucose level in your blood, and increase your heart rate. And if the dangerous situation never change, and you gradually go to the resistance phase, and that's the response. And eventually, it will go to the exhausting phase, because apparently your body could not always behave like you're fighting bear for 2 weeks or even 2 months. Eventually, you reach the exhausting phase, and your organ fail, and you get sick. Okay, that's it.